Spring is here, and with it, a sense of optimism.
I don't need to worry to wear masks anymore.
I feel like now it's slightly life started getting back to normal.
It's something we're just going to have to live with.
Around the country, COVID numbers have nosedived from 55,000 6 weeks ago to just over 12,000 today. Hospitalisations and deaths are also down. And that has some armchair epidemiologists ready to declare the pandemic over.
I think life's kind of getting back to normal.
Yeah, move forward with our lives and roll on to the good times.
Even actual experts are becoming cautiously optimistic.
We have no other variants of concern, some variants on the horizon. In fact, we don't have anything in that distant view is actually really encouraging.
So what defines the end of a pandemic?
If we can have 6 months, including the Northern Hemisphere start of winter, looking pretty stable, then that's when they might call the pandemic over.
National Cabinet, though, isn't waiting that long to take action. The PM this afternoon announcing plans to scrap mandatory masks on planes, and the big one, reducing mandatory isolation from 7 days to 5, except for workers in high-risk settings like aged care.
This would apply to people with no symptoms. Clearly, if you have symptoms, we want people to stay home. We want people to act responsibly.
Pandemic leave payments will be reduced to reflect the new isolation period. But so far, the feds are resisting calls to extend the payment beyond the September 30 end date.
What we do with paid pandemic leave, we'll have a meeting about that in a couple of weeks, about where that goes.
The PM assuring Australians that today's decision is the right move at the right time.
We'll continue to assess these issues and what restrictions are appropriate at any point in time.
Well, Professor Jane Holton is chair of the Coalition for Epidemic Preparedness Innovations and is here to talk us through these changes. Jane, an epidemiologist has tweeted this afternoon that overseas studies shows the reduction of the ISO period from 7 to 5 days means that of the 13,000 plus new COVID cases today, around 6.5 will be infectious on day 5 and go out and spread the virus. Do you think 5 days is the right amount of ISO?
Look, I think 5 days is proportionate given where we're at in the stage of the pandemic, and it's important to understand that that study actually says that most of those people to the end of the 5 days will actually not be anywhere near as infectious in the first 5 days. So the risk that they will be infecting people is much, much lower.
The federal government, the big issue is the payments. The federal government is saying they're going to keep them for now. They're not saying that they'll continue those isolation payments beyond the September 30 deadline. Can you get rid of them, though, while you still require by law people to remain in isolation if they have COVID?
Well, so that's the thing that the government's going to struggle with, and I think rightly the Prime Minister has said that they'll think about this in a couple of weeks' time. Those pandemic payments have been really important to people, helping them actually afford the isolation, particularly if they're in insecure employment. So I think the Prime Minister rightly did not come to a conclusion today, and he said he's going to think about it. It will be tough to end them, particularly where we have mandatory isolation, because we know for some people they do need to go to work because they don't actually have income if they don't go to work, but we want them to stay home if they're crook.
Jane, masks on planes are no longer compulsory. Are we going the wrong direction here? It feels like there's such a simple way to stop the spread.
So 9th of September, that rule is going to change. For anyone who's been out of the country, you will know that actually those rules don't apply and haven't applied for quite a long time now overseas. I'm actually not worried about that requirement. The airlines have done a great job when it comes to actually increasing ventilation on planes. And of course, let's remind everybody there's a courtesy part of this. If you're not well, don't travel. And if you've got any kind of a symptom, make sure you wear a mask. Do it voluntarily, and that will actually help control this. But I think that's a prudent step given where we're at now.
You're preparing a paper for the government on all of this. What does, in your opinion, the end of the pandemic look like?
Well, your intro, I think, covered it pretty well. What I'm saying to people is it's not COVID stable yet. We can't predict where the virus is going, so we've got to be ready in case we do have another variant. Boy, we all hope we're not going to have one. I sure do. But of course, we don't know that we won't. So we've got another period to go. If in 6 to 12 months it's continuing to trend down, we of course have great levels of vaccination coverage in Australia, and lots of people have had COVID now and do have some level of immunity. So ask me this question in 6 and 12 months' time. I'm not declaring it yet, but boy, am I I hopeful we can in that kind of time frame.
It's a real shame, Jane. We wanted you to declare it on live TV with us. Apparently, you're not up for that.
Sorry.
Yeah.
No, sadly, no, not this evening.
Can I just zoom out on what you're saying there, though, about things like shortening the isolation period and masks on planes and so on?
Yep.
I get that people might want those things because you don't want to be in isolation for as long and you don't want to wear a mask on a plane. But what's the actual upside of doing that? Like, what are the benefits that we're meant to be getting by taking this, even if slightly more relaxed approach?
Well, I think the advantage to us, we know that our economy has struggled and we know everyone's conscious of workforce shortages. So I think there's a balance here between the protections that we all want and need, particularly for vulnerable people, but also enabling our whole society to get back to where we want to be. And think particularly of those children who've had a couple of years of home education. And not that I think parents aren't great at looking after their kids, but, you know, teachers are good at this and we want our kids to be back in schools with teachers who aren't sick at home. So it's that balance that we're striking here, and we do need our economy to be up and running because, let's be honest, that's how we all build wealth and that's how we all make our way in the world. So it is a balance, and gee, it's a tough decision for governments when you don't know where this is going, and I think every government, the last government, but also this government, has to think that through, and that's what we're seeing.
All right, Jane, always good to chat. Thanks for your time.
Pleasure.